Well, the safety of silver fillings is making headlines again, and whether or not you should have them removed. This comes after the Florida Surgeon General recommended against the use of these fillings in August, citing potential risk from mercury exposure.
However, the FDA and the American Dental Association maintain that these fillings are safe. Our Jay Jarvis spoke with local dental professionals on both sides of the debate about how to make the best decision for your health.
We see a lot of silver fillings. We see a lot of people from all walks of life.
Those silver fillings you may have in your mouth are actually made of dental amalgam, a mixture of metals made of 50% elemental mercury and an alloy composed of silver, tin, and copper. Dr. Nick DeFabrique, a dentist who has been in practice in Palm Beach Gardens for 25 years, says it's been used since the early 1800s and is safe.
Once that material is completely set, the mercury is no longer in its free form, and it's usually pretty stable, assuming that the filling is well placed and that the filling is not broken.
But the mercury in those fillings is causing some in the medical community to recommend against its use, like Florida Surgeon General Dr. Joseph Ladapo, who issued guidance in August saying the mercury vapor released by the fillings can cause damage to blood cells and kidneys.
Technically, if the filling is breaking down, you can run the risk of ingesting mercury from a broken filling. But a well-done filling and a filling that is not breaking down is stable, and there is no danger in that case. To get mercury toxicity, you either get it through ingestion or direct blood contact of that filling. And inside a tooth, there's not direct blood contact.
The FDA does not recommend amalgam fillings in good condition be removed or replaced unless considered medically necessary, and removing them could cause problems.
So what are the risks of having amalgam fillings removed if you are not having any medical complications first?
So whenever you drill into the tooth, you run the risk of causing problems with the nerve of the tooth. You run the risk of the tooth breaking.
And the FDA says the exposure to mercury vapors could pose a greater health risk to certain groups of people, including children, especially younger than the age of 6, pregnant women and their unborn children, and people with pre-existing neurological disease or impaired kidney function. That's why other dentists say amalgam fillings are not a good option.
When we treat the mouth, we want to consider the whole body. We want to make sure that when any materials that we place in the mouth, that they're safe and biocompatible for the whole body to prevent any conditions and also to protect from toxic effects.
Dr. Trupti Lofholm is a dentist at Pure Dental Care in Palm Springs, focusing on holistic biologic care. She explained to us how she prepares patients for amalgam filling removals.
Once they come and do that evaluation and diagnosis, we go through a protocol called SMART. It's Safe Mercury Amalgam Removal Technique. And then we're also going to cover the patient from head to toe with protective covering. We are also protected, and we have high vacuum filtration system in the room as well. The important thing is that patients don't swallow it and they don't breathe it in.
Lofholm says her practice currently sees anywhere from 20 to 30 patients a month for removals.
So why do you think people are now coming in and kind of saying, oh, I want to have this removed?
I think patients are actually becoming more aware of trying to be in a healthy lifestyle. And when it comes to even their oral health, they want to try to prevent. And then as they start researching about mercury and fluoride and different materials that are out there before they get a procedure, I think online there's so much available. So now when they come in, they're already pretty educated on the process and they're looking for a place that they can go that has that certification and that protocol in place for them.
DeFabrique and Lofholm agree that the first step as you consider your options is to talk to a trusted dentist.
Us as dental providers, we can research, we can talk to the patient, we can educate the patient on whether or not the filling is breaking down, on whether or not the filling is causing problems for their health based on their symptoms.
In Palm Beach Gardens, Jay Jarvis, WPBF 25 News.